Well, students are spending more time this year on devices with school in a hybrid model or fully remote this year.
So how's all this technology and screen time affecting the health of our children? Donna Mazyck, Executive Director of the National Association of School Nurses, and Dr. Rupa Wong are sharing tips on how to keep an eye on these issues and keep your kids healthy. Welcome to both of you.
Thank you.
I guess we'll start with how has the role of a school nurse changed now that the pandemic has hit and a lot of kids are home these days?
Well, the essentials of school nursing remain the health and safety of all students. So whether they're in-person learning or learning virtually, school nurses are now adding in those communications directly into the home regularly to make sure that parents have what they need to keep their children healthy and safe.
I wouldn't even think, I guess we can still call our school nurse, or if you're questioning, now if kids are sick, they're sending them right to the school nurse if they're in that week. So really using them as a resource. But Dr. Wong, you said you're worried about all the screen time and that some children are actually developing nearsightedness and we might not even know it.
Yes, I mean, before they used to think that nearsightedness or myopia was just genetic, and if your parent had it, then you had it. But now we're finding all these lifestyle factors like less time spent outdoors and more time doing near work, either on a device or reading a book, is causing this increase in nearsightedness. So we're getting a lot of parents who they themselves are not nearsighted, but their children may be. So there's actually a really great website. It's coopervision.com, and they've got two wonderful tools that I recommend to patients, parents. One is a myopia simulator. So if the parent's not nearsighted, this simulator shows you what the nearsighted world looks like for your child. It has a picture of a classroom and a picture of a gym, and you can toggle back and forth for making the child more nearsighted on the simulator. The second one's a quiz, and I love a good quiz. And this is just 6 questions that the parents can answer to uncover the likelihood that their child is nearsighted. And what we're seeing is with all this up-close work, nearsightedness is just getting progressively worse. And in the past, I could never really offer parents much to slow that down. But now we have a new FDA-approved contact lens. And as a mom and a pediatric ophthalmologist, this is really great because I have something that I can offer my patients' parents. It's an FDA-approved device, a contact lens that slows myopia progression. It's called MySight when kids start treatment between the ages of 6 and 12. So something that I can actually tell parents that might help.
I guess either one of you can answer this next question. Because school closed so early last year, are kids now behind in their screenings?
Yes. Students are behind in their screenings and also their well-child checkups. And so school nurses are encouraging families to make sure students are up to date on their vaccinations, that they get the annual flu vaccine, and that they catch up on those wellness visits that they have missed, which would include an annual visit to an eye care professional.
So let me clarify that. I know my kids, they actually did get their well visits, and I know doctors here in Connecticut are encouraging you, keep those well visits, get them in there. But if you do the eye exam at the pediatricians, is that enough, or do you need to go to the eye doctor every year?
It's the results of that annual pediatrician visit. So for those who need more follow-up for a comprehensive eye exam, that pediatrician will refer them to the eye care specialist.
Okay.
Dr. Wong would receive them.
Well, we want to just thank you both so much for the information and for helping to keep our kids safe and healthy. Thank you so much for being with us on Better.
Thank you for having us.